Monitoring. Much of the monitoring required for someone with diabetes is performed by their doctor or nurse. This includes the HbA1c, blood pressure, blood cholesterol level, and urine tests. These tests are usually performed once a year, but tests such as the HbA1c may be performed every 6 months.
As part of your annual review, you will always have a blood test taken, which will include something called the HbA1c. That's a record of how much of your blood count, so that's your haemoglobin, that's the HB bit, how much of that has actually got sugar stuck onto it. That seems a funny thing to measure, but it's a really good way of telling roughly what your sugar levels have been over the last 2 or 3 months. So it's actually much more useful than just checking a blood sugar level now, because this is telling your healthcare professional, nurse, doctor, whoever, what your control's been like all day, every day for the last 3 months. Has overall it been really good, or overall are the sugars a little bit higher than you'd like to see? We've talked about how diabetes can affect the blood vessels in the body. It can also affect the heart, and people with diabetes need to really look after their hearts, keep heart healthy. If the blood pressure happens to rise, that's going to put more of a strain on the heart, and so people with diabetes ought to have their blood pressure checked regularly to keep it nicely under control.
People with type 2 diabetes are more likely to have slightly higher blood pressures than the background population without diabetes, and again, it's one of the things that people with diabetes don't always pay as much attention to, being very focused on the glucose measurements. Most general practices are usually very good at trying to get blood pressure down to target, and the target blood pressure varies from person to person, and clearly people who are in their 40s will have a different blood pressure target to those who are in their 80s. But I think people with diabetes should be talking to their practice nurses and GPs about their blood pressure just as much as they're talking about their blood glucose, and saying, well, what's my blood pressure target? And a reasonable sort of target would be around 135, 140 systolic, which is the top of the usual blood pressure readings. Although some people might need a slightly lower reading, and in older people it's often acceptable to have a slightly higher target.
At an annual review, a person's renal status will be checked. The GP or the healthcare professional will check cholesterol level, and if necessary the patient would be put on a statin.
A lot of people think that they should only be taking a statin if their cholesterol's above a certain level, but that's not quite correct, because the evidence is pretty much that everybody with diabetes over the age of 40 should take a statin regardless of what their cholesterol is. So the trigger for needing statin treatment in diabetes is not your cholesterol measurement, it's how old you are. And if you're over 40 with diabetes, nearly everybody should be on a statin. I mean, there are some people who've had bad side effects, there are some people who are intolerant of certain statins, there are people who don't want to take a statin, but generally most people should be offered a statin if they've got diabetes over the age of 40.
Well, we used to think that anybody with diabetes needed to test their blood sugars, but recent research has shown that actually if you're on tablets because you've got type 2 diabetes, testing your blood sugar every day doesn't actually lead to better blood glucose control.
Some people with diabetes need to test their blood sugars. Some people with diabetes will test their urine, and some others will also test their blood ketones. There's no one size fits all. You need to talk to your own diabetes specialist, nurse or doctor to get advice.
The information I was told was that because if you test every morning like I was at one point told, then within 2 minutes my blood sugar levels could be different. So therefore there's no point in taking a test every morning. See how you feel. If you feel okay, don't test. Having said that, I have been asked to test if I go on a long car journey.
I test my blood sugars 5 or 6 times a day. So I always test my blood sugar when I get up in the morning, before breakfast, that is, and always before lunch, always before dinner. So it's always important to test your blood sugar before you eat, because otherwise you don't know how much insulin to inject. And then I always test my blood sugar before I go to bed.
If you are planning pregnancy, testing your blood glucose is absolutely vital in order to have as well controlled diabetes as possible when you conceive the baby. And in that situation, the women would be asked to test before all their meals and after their meals, so that they really are getting tight control of their blood sugars.
I used to have a book when I was pregnant. I would always write it down in a book. So I would literally test my blood sugar level when I got up in the morning, before I ate, probably about an hour after I ate, 2 hours after I ate, and then so would do that throughout the day, any time before I was driving anywhere, all those sorts of things before I went to bed, and occasionally get up and do it in the middle of the night as well, just to make sure you're not going hypo during the night.
If you are well with type 2 diabetes and following a healthy diet rather than needing any medication, you shouldn't need to test at all. With certain tablet medications, it's worthwhile testing if you're unwell or if you're worried that you're having a hypo. But again, most people with type 2 diabetes on tablets and diet don't need to test regularly at all at home. Most people with diabetes jog along very happily for most of the time. If, on the other hand, something doesn't feel right, if your weight suddenly changes, you're losing weight, you feel unwell, you're passing a lot of urine, for example, if something has changed, all these things can be a clue that you need to start testing a little bit more frequently and go and see your doctor. If you don't think something's right, you're probably right. Finally, though, at the other extreme, people who are treated with insulin and certain other drugs for their diabetes have to test their blood sugars to make sure, firstly, that they're safe, that they're not becoming low or hypo, particularly if they drive a car, for example, but also to help them work out whether their dose needs to change. So people with insulin-treated diabetes will often test their blood sugars in order for them to decide what dose they need to take of their insulin.
We will now discuss some basic principles of self-monitoring of blood glucose levels.
A patient will be given a meter and then they're going to be shown how to use that meter.
It is important to make sure all the equipment required to test the person's blood glucose levels are collected together. This will include meter, test strips, a finger pricking device with a new lancet and diary to record the results. Some people like to have a piece of cotton wool.
Then the meter will show them what their reading is and they'll be told what sort of blood sugar levels to be looking for.
Prepare the finger pricking device by putting in a new lancet and loading it ready. Hands must be washed and dried to ensure there are no traces of anything that will affect the reading. The warmer the hands, the better the blood flow, so washing them in warm water will help. Place a test strip into the meter and always check the expiry date on the strips before they are used. If they're out of date, they may not give accurate readings, so order new ones. Prick the finger with the lancet device using the sides of the fingers, as there are less nerve endings here than on the pads. Pricking the pads can be painful and make them feel quite bruised. Always use a different finger as well as a different area of the finger each time.
The meter will show them what their reading is and they'll be told what sort of blood sugar levels to be looking for, and if they're not hitting those targets then they know they need to access help.
It may help to hold the hand down to help the blood flow. When the blood appears, transfer it to the test strip. The meter will usually give a readout within a few seconds. Clean any blood off the finger with the cotton wool. Dispose of the used test strip and put the lancet in a sharps bin. Record the result in the monitoring diary. If asked to monitor blood glucose levels at home, it is because there is a need to either help your doctor or nurse make decisions about medication changes or to satisfy the law in relation to driving.